I didn't see you there. Welcome to the CAEP vlog, Stuart.
Wow, Chris, you scared me. I think we better sit down.
I'm here today with Stuart Rose, an emergency physician here in Calgary and an expert on clinical debriefing. So welcome to the CAEP vlog, Stuart.
Thank you very much, Chris. Thanks for doing the blog with me. I really appreciate it.
So tell me about clinical debriefing.
So, Chris, one of the things that I do a lot of simulation, and I think sim is a fantastic medium for teaching and for learning, but the learning really takes place in the debriefings afterwards.
Right.
We don't learn very much from the cases themselves, but we do learn a lot in the debriefings. And it really frustrated me that in our clinical day-to-day practice, we weren't doing the same thing. We were missing opportunities every time we have a clinical case to learn and improve our patients' outcomes, improve how we feel about what we do. So that was kind of the motivation for the process we started of clinical debriefing in the Calgary Emerges.
Yeah.
And that's kind of where we got to where we are right now.
Right. And we have Stan, the sim man, behind us here.
We do.
Beautiful
Stan's
Stan.
helping us out here today.
Stan's been helping us out. It's almost like sim is kind of one of those things that's like school for children, is what I'm thinking, is that you go to school when you're a kid mainly to learn social interaction, teamwork, how to do those type of things, and a lot of the time we focus as sim as being on the actual case and the medicine and the resuscitation and all that kind of thing, but really the huge learning we can get from it comes from the actual team interaction and looking at that part of it.
Well, it's a perfect opportunity because we don't often get those times where we can step back in a safe environment and discuss what just happened.
Right.
And communication is such an important part of a team. When you're bringing experts who are working in their field, they're really good at what they do, and when you get them together, you run the risk of having a collective incompetent team.
Right.
And so really an important part of managing any team is to bring the best out of each member.
Right.
And we're not going to do that just on our own. Well, sometimes we do, fortunately.
Yeah.
But like any team, we need to practice. And talking about what we do is important.
Yeah, you don't get the best basketball or football team in the world from not having any discussion about what happened on the field afterwards.
Exactly. You don't get the Ferrari tire change during the Grand Prix that just all of a sudden comes together.
Right.
And yet people expect us to do that every time we do a resuscitation.
Yeah, so we do a resuscitation and we just expect a bunch of people who maybe haven't ever worked together are going to come together naturally because they all have an area of expertise, but they haven't even talked, and the patient just rolls in and there's no warning, and we're going to function like a perfect unit.
Exactly.
Yeah.
And even if we did that resuscitation an hour later, we'd still have different people doing different things. So it's so important to have a good, clear communication and team dynamic.
So tell me about what you're doing in Calgary with this.
So Chris, we've developed a clinical debriefing or real event debriefing process called INFO, which is a mnemonic. It stands for immediate, not for personal assessment, fast facilitated feedback, so 3 Fs, and opportunity to ask questions. And it's a charge nurse facilitated interprofessional process, so anybody can ask for the debriefing. And it's been running in Calgary now since March of 2016. The mean time for a debriefing is 10 minutes. The mean number of participants is 7, though we've been up to anywhere as big as 25, which does take a little longer. We've done over 300 documented debriefs so far, and a whole lot more informal and undocumented debriefings. And it seems pretty well received by the staff.
Yeah.
So what we are doing at CAEP is we are holding a pre-con to teach you to do the same thing. So if you want to learn to debrief clinical real events in your workplace, please sign up for our pre-conference. Yeah. It's called the INFO Teach the Teacher Workshop, and it's going to be a 4-hour workshop on the 26th of May.
Fantastic. And you can also follow Stuart on Twitter at INFO Debriefing. So this guy loves debriefing through and through, but it's something that's super important for our profession. I mean, we talk about how we go through residency, we do sim all the time, we have these 45-minute debriefings, and then we get into practice and we decide that now we're working on real people and we're not going to debrief regularly. Which seems kind of a...
It's amazing. There are lots of perceived barriers to getting a debriefing program established.
Right.
And it is difficult to do, for sure. But the value to ourselves as frontline clinicians, to the rest of our colleagues and to our patients. I think we really need to make an effort to make this happen. And so, yeah, let's start changing the culture.
Yeah, it's time to start changing the culture, and you can do that by registering for the pre-conference and learning how to bring this back to your emergency department. So you rolled this out at the Rocky View Hospital here in 2016, and there's a little bit of data or something coming out?
That's right, Chris. I've put together a paper describing the INFO clinical debriefing process, and hopefully that should be published pretty soon in CJEM online initially, and it's a broad description of what we've done so far.
We'll put the link to the article down below this video, and there's also an infographic, right, Stuart?
Yeah, so the infographic describes the post-implementation survey that we did after a 6-month pilot at the Rocky View. We had debriefed 50 cases, and it's a brief summary of that survey.
Great. So both of those things can be found down below. Is there anything else you wanted to add, Stuart?
Just get out there and start debriefing. It's really important for us all.
Thanks very much, Stuart.
Thank you, Chris. Thanks for having me.
We have less than a month until CAEP 2018, May 26th through 29th here in Calgary. Follow me at SOCMobEM as well as Stuart at INFO Debriefing on Twitter. Also follow the CAEP Conference account at CAEP Conference, and check out our website for all of the talks, all of the tracks, all of the pre-conferences, and we're looking forward to seeing you at CAEP 2018.